Hi, my name is Andreas Budi, and today I'm going to talk about Hashimoto's thyroiditis. As the name implies, Hashimoto's thyroiditis is inflammation of the thyroid. It's an autoimmune disease that destroys the thyroid cells in the thyroid gland. It's causing these chronic inflammation of the thyroid gland. Uh, it's the most common, and as a result, causing hypothyroidism. It's the most common cause of hypothyroidism in the United States and other first world countries. Um, and the cause of this is pretty much antibodies attacking the thyroid cells, especially. There are two antibodies that is thought to be related that causing this, and it is pretty much the anti-TPO or thyroid peroxidase, which is an enzyme that oxidizes iodide into iodine, which is needed to create thyroid hormones, especially T4 and T3, thyroxine and triiodothyronine. It is also thought that they have antibody towards thyroglobulin and impair destruction of all the both these cells will impair the thyroid's ability to make hormone. Now, the thyroid gland's ability is to make thyroid hormone, like I said, thyroxine and thyroidothyronine, and these thyroid hormones are endocrine and they go to the body's tissues and organs, and it helps them to keep them warm and utilize energy. Now, in the Hashimoto's thyroiditis, these antibodies are attacking these cells, and as a result, the the thyroid gland's ability to make hormone is decreased, and the T4 and T3 levels are decreased as well. And the symptoms include fatigue, weight gain, constipation, increased sensitivity to cold, xeroderma, myasthenia, alopecia, myalgia, menorrhagia, and actually in exercise tolerance. Now, the way this disease is tested is that they're testing for a level of TSH and level of thyroid hormones, especially the free T4, and it's been correlated with the presence of TPO antibody as well, but it's not been proven to be a causality. There's no direct connection between the increased level of antibody TPO to the severity of disease. But the pretty much the patient are being tested for the level of TSH. Thyroid stimulating hormone, or TSH, are created by anterior pituitary, and in turn it affects the thyroid gland to create thyroid hormone. So when the thyroid cells are destroyed, the T4 will go down, and in turn will create the anti-pituitary to make more TSH. So when the TSH is elevated, the T4 is going down, and that's how, and along with the anti-TPO levels, that's how you diagnose the disease. And when you have that elevated level of TSH but low level of T4, then you have hormone therapy, or hormone replacement therapy, or the HRT, and one of the drugs is a levothyroxine. And you test that within 3 to 6 months or within a year to find the correct dosage of levothyroxine to create that thyroid hormone. And in turn, you take the TSH tests again to make sure they're level. And that, in a nutshell, is Hashimoto's thyroiditis. Thank you.